Joined here in the studio by Dr. Rudy Navari, class of 1966. Dr. Navari is a world-renowned physician and cancer specialist, the former dean, the director of the Indiana School of Medicine, South Bend, and now director of the Cancer Care Program in Eastern Europe for the World Health Organization. Dr. Navari, really a pleasure and great of you to come back and be a part of this.
Well, thanks for having me.
Tell me a little bit about maybe what first drew you to this campus. You came here as an undergrad, and now here you are all these years later coming back and doing so many wonderful things here.
Well, Chris, I was an undergraduate here and then actually got a degree here in chemical engineering, but migrated to clinical medicine and migrated to medical oncology and cancer treatment because that really was my passion. I tell medical students that on their first day, if you want to make money, go to Wall Street, but if you want to take care of sick people, then you should do medicine. So I did medical oncology and did medicine because it was the thing that I really didn't want to go to bed at night. And I really, when I woke up in the morning, I really wanted to, I couldn't wait to wake up to get to work to take care of sick people. And oncology is my passion, and we're doing very well in cancer treatment today.
And let's start here at home first. The Harper Cancer Center, I believe, and is your pet project from the beginning. Tell me a little bit about that.
Well, we were fortunate to start the Harper Cancer Research Institute. It's a partnership between Notre Dame and IU School of Medicine in South Bend. And Mike Harper gave $10 million, and the state matched it. And so this program is on campus now, and it's working very well, recruiting very good scientists and doing basic cancer research on campus. And it's a partnership between the School of Medicine, Indiana, and Notre Dame.
Digger's telling me your goal is to have the top 10 physicians from around the world, and you're up to 4, I heard. Is that about right?
Well, we've been successful in recruiting people, very good people.
That's awesome.
And so it's attracting funds from the NIH and the NCI, so it's doing well.
Congratulations. Now, you also are with the World Health Organization now, and as much progress as has been made in this country with cancer treatment and some of the drugs, there are still issues in other parts of the world getting those drugs to them, right?
Right. So the drugs we use now in cancer treatment really didn't exist 5 to 10 years ago. The drugs we used 10 years ago didn't exist, we don't use today, and we're now improving survival in the United States. We're improving survival in Western Europe, but we're not improving survival in Eastern Europe and those countries because they can't afford the drugs. Our cancer drugs cost $10,000 a month, and so the World Health Organization instituted a program about a year and a half ago and asked me to participate, in which we're partnering with the pharmaceutical companies to get these new cancer drugs to Eastern European countries at cost. And we've enrolled about 2,000 patients now over the past year, and we're starting to see some improved survival in those patients.
It's just spectacular, the work you've done, and you've also been so kind to the university. You're a philanthropist at the highest level, and if you would just talk a little bit about why South Bend, why Notre Dame, and why does it mean so much to you?
Well, I think the university is unique in the sense that they strive for academic excellence. And I think students who go here get a really very, very good education on par with Ivy League schools. The students here are interested in social justice and service. I think that besides academic excellence, Notre Dame's a real family, and people care about each other here. And they do a very good job of blending the faith of the Catholic Church with academic excellence and service. And so it's just a unique place, and it's a place that I think that we need to encourage and to support, and I think it continues to do very well.
The World Health Organization in Switzerland, where is that?
Yeah, so, well, they have multiple offices, but I work out of the Geneva office.
So Geneva, but your home is still in South Bend? That's a heck of a commute back and forth.
It's a long commute. So I spend about half my time in Geneva and half my time in South Bend. I travel a lot to Eastern Europe, and we've set up 10 or 12 cancer centers in Eastern Europe, and we're getting the new drugs to those patients, and so I'm very pleased that we're able to do that.
In a quick answer. What's next? What's next on the cancer front?
What's next and what's going on now is we are developing the knowledge of the genetics of every cancer, lung cancer, breast cancer, prostate cancer, colon cancer, and we're developing drugs against finding out what the genetics are and developing drugs to treat those cancers on the basis of genetics. And so we are in a very exciting time in cancer biology.
Dr. Navari, it's an honor to meet you, and we can't thank you enough for being here and for all you do.
Thank you. Thank you, Chris.
Thank you very much.